After months of frustration and confusion, today marked the beginning of a new era in health care in this country as the Affordable Care Act went into effect and millions of Americans began to be covered by health insurance. The government says more than 2 million have now signed up. The White House hopes millions more will enroll in the coming months before everyone is required to have insurance by the end of March. But even today, the Obama administration found itself dealing with another issue. We get more on that from NBC's Tom Costello.
$30 in network, 40% coinsurance after deductible.
In Delaware, the Herring-Shovlino family has been waiting for this day. Both of them artists. Kathy was stuck in an expensive policy because of a pre-existing condition. But after persisting all through the Obamacare website troubles, they and their teenage son are covered under one cheaper policy effective today.
This means a lot to people like us, being self-employed, being able to have access to a good health care plan.
The new law means no more denying coverage because of pre-existing conditions, no more lifetime dollar caps on insurance claims. But millions have been kicked off their insurance policies that didn't meet the new minimum standards, and computer errors persist. The question today, how will it all work?
Does it work? Do the people who manage to sign up through the website, can they go to the doctor, can they go to the pharmacy and get the health care coverage that they didn't have before?
Late Tuesday, a Supreme Court injunction giving several Catholic groups a temporary exemption to parts of the new law that require employers to provide insurance coverage that includes contraception. While the administration has issued rules it believes address religious concerns, several challenges are now working their way through the courts. Meanwhile, troubling signs in Michigan, where the second largest insurer says customer confusion is a big reason why very few uninsured have signed up there.
This cannot succeed without some adjustments. I think everybody was hopeful that this would actually make a difference. And I think the adjustments are critical to make it be successful the way we wanted it to be.
Still, supporters of health care reform believe today is at least a start.
We'll begin to move toward a country in which most everyone has health insurance coverage instead of a country with large numbers of uninsured as we have today.
There are many trouble spots, though. People who signed up who haven't yet received their ID cards or aren't yet showing up in the right computer system. Confusion over premiums and benefits. But tonight, millions of Americans are insured under the Obamacare system, and the numbers of people signing up are expected to increase in the next year.